people from death if he or she is infected by this kind of bacteria or fungus or virus. And we are now discussing about antimicrobial resistance. As you all know, this is a global issue. WHO, CDC and UN is discussing about this problem. And I think 2016, UN had some declarations about IPC and AMR. WHO also identified this is the most severe security threat. And UN addressed in 2016 in UN Assembly this great difficulty. And CDC recognized it is a top priority. Antimicrobial resistance is a top priority. As I said earlier, the interconnectedness of the issue is most important. Human, animal, and environmental health. This is an era of several zoonotics. Zoonotic diseases are appearing in several places. I was former health minister in Kerala, one of the states in India, and the Nipah virus occurred there in 2018. It is unexpected in Kerala. But we identified the virus as early as possible, and we started to prepare some protocol and standard operating procedure to contain that virus. A very good team was formed there. At that time, we thought more about the infection prevention and control. And that time we assembled all the other stakeholders, veterinary, agriculture, and other stakeholders together to meet, to tackle the problem of Nipah virus. At that time itself, it was in our mind that we should start a very good project on antimicrobial resistance. And 2000 itself, we had a very good workshop on antimicrobial resistance in Kerala, and we framed a very good action plan on it. To combat the antimicrobial resistance, the most important thing is the surveillance, research and education. Kerala has become, I am proud to say, I am very happy to say that Kerala has become the first state in India to release a sub-national action plan on antimicrobial resistance. That is called KARSAP, Kerala Action Plan on Research and Stewardship Action Plan to prevent the antimicrobial resistance. And it was released, the action plan was released to the public by our Honorable Chief Minister Sri Pinarayi Vijayan in 2018. And I got an opportunity to preside over that function. And I was very happy to inform you about our KARSAP program. KARSAP is totally conceptualized and implementation on a One Health approach. We had very good workshops on KARSAP, and the focal points of I want to introduce that program in front of you, because all the other states are now starting to have some discussion on antimicrobial resistance and to frame their own projects and programs on antimicrobial resistance. The first is the infection prevention control, and we have to do a very good surveillance on that, and the information dissemination is the most important thing. How to make aware of these things to the total population, to the whole population of our place, that is most important thing. Animal husbandry have to do a most important thing in this arena. As you all know, we acted well, and we have several sub-projects and programs under KARSAP. KARSNet was one. The surveillance network we started there, and we started another project called PROUD, that is to collect unused medicines and the medicines which are completed the period, or the medicines which have the expiry date is over, and tons of medicines we collected and sent to the center where we can use it or destroy it. And fisheries and agriculture sector we join them together. There is a threat that if we can reduce AMR, and it is only possible through the interconnected work. Kerala reduced this kind of thing, infection, have a control on infection, but the threat is that we are a consumer state. And all the vegetables and meat, I think 42% of the vegetable we need is producing in our state. The major part is coming from the neighbor states, and the broiler chicken, etc. meat is also coming from outside. If our neighboring states are not bothered about antimicrobial resistance and some control, we cannot prevent this fully. So it is an interconnected thing. No one is safe until everyone is safe. So it is a national issue. We should have to take like that. The cattle feed and the things used for agricultural area, that also increase the antimicrobial resistance, and they are coming to Kerala. We have to prevent that thing also. We cannot prevent the importing of food items and other things from other places, but awareness should be created there also. That is the main problem. And you can read, we are working for awareness program even in school and in public for agricultural workers. We gave very good study classes and awareness programs in Kerala. It is going on. Coordinating all these activities is most important thing. As I said, the following are the strategic priority of our program Karsab. First, awareness and understanding. Communication, information, education and communication is the most important thing. And training is the other thing. During Nipah and COVID, we were able to overcome these great threats because of a very good teamwork and very good training also. When Nipah virus came there, we gave vigorous training before that, not after it, before that, after the Nipah incident and before the Nipah incident, we started to tackle the problem of hospital infection control, healthcare related infection, especially for reducing the mortality in some sector. For example, in Kerala, child mortality rate is very low. While I was minister, I took charge of the minister in 2016. The child mortality rate in Kerala was 12 out of 1,000 live births. It was the lowest in India. But we take an oath that we will reduce the child mortality rate to single digit. And we tried hard for that. Several teams were made for working on it. One important thing is to improve the hygienity and the technically very good technology of the delivery points. In Kerala, we have 62 delivery points in government sector, and all that delivery points we converted or make it most modern and of good hygienity, very clean and technologically fit. And other thing, we started the several things to tackle the child mortality rate. One is we introduced a special project on it called Hridyam. It is especially for congenital heart disease. If any child is born with congenital heart disease, through our Hridyam project, we were giving free treatment, free operation, and we empaneled some private hospitals also, Aster, Amrita, Sri Chitra, it is not private, Sri Chitra, and we had done a good job on that. Because of this hygienity and hospital infection control, I can proudly say we reduced the child mortality rate, and in 2020 it go down from 12 to 5 out of 1,000 live birth. That is the lowest in India, I can say so, Maternal mortality rate also, the same thing, infection control and the examination on this mother and so many other projects were there, and maternal mortality rate reduced from 67. It was 67 in 2016 and it reduced it to, I cannot say, I don't know whether you believe or not, it reduced to 19 out of 1 lakh birth from 67 to 19. I'm saying because we can do something. If we intentionally arrange some projects and some training and some work, we can achieve something out of that. Similarly, the antimicrobial resistance, we should have that kind of activities. That is why I am explaining some of the experience and result we achieved in Kerala. And we have a very good committee on antimicrobial resistance program. Chief Minister was the chairman of this committee. He led the committee, and Health Minister was also in the meeting. Health Minister is chairing the committee, and also we have some targets on that committee. You can get in the net, Google, if you search in Google, you will be able to get everything about the antimicrobial resistance and stewardship action plan of Kerala. And our targets, we have 1 year target, 2 year target and 3 year target. As UN said, up to 2030 there are some goals declared by UN in 2015. And according to that targets, I know that UN declaration of the Sustainable Development Goal, the third component is a guide about health, and we should have to apply that thing also in our activities. In Kerala, we also declared sustainable goals according to the UN declaration, and this maternal and child mortality rate, we declared that goal according to UN's sustainable goal, and so many other things to how to reduce or prevent tuberculosis, and everything was there. We have 23 special goals according to it. And here also we declared some goals on AMR reduction, antimicrobial resistance reduction, and we launched some kind of projects in 2019, making all Kerala citizens aware about the judicious use of antibiotics. Not only the poor folk, but also the doctors and nurses should know how to use antibiotics. They have the knowledge, but sometimes some mistakes are there in prescribing. If a person caught a viral infection, unknowingly some doctors are prescribing antibiotics. Not one type. Some doctors are prescribing more than one type, 2 or 3 types of antibiotics at the same time. We can't believe that. So, awareness should be created there itself. How can we prescribe antibiotic? How can we use it? And how can we throw out if they didn't want to swallow it? But in every houses we can see they are dumping the antibiotics with other weights. They are not using it fully. So awareness should be created among the doctors to prescribe how much and what antibiotics, when they have to prescribe antibiotics. That also is a very good, very necessary thing in this program. And 2023, we have a very good app to have the antibiotic awareness, and also we are collecting report through that app. And throughout Kerala, we are implementing this thing. 2023, we have some antibiotic angiogram also we are doing in Kerala. And the surveillance and antimicrobial stewardship program, we initiated at 13 out of 14 districts. And the one district that also we will implement soon. And AI-based solution is also in our awareness, or we are thinking about artificial intelligence-based programs also for awareness creation and for the implementation in the KARSA program. And we have a range of antimicrobial resistance, ROAR. That initiative was launched by the Department of Drug Control also. So the veterinary department, drug control, health department, every department has joined together to tackle the problem. The capacity building is the most important thing. Trained healthcare professionals, COVID-19 management, we understand that thing. When we understood that COVID is coming, before we started our training, I read in some newspapers that a potential virus is spreading in Wuhan. At once we started our action there. After that COVID come, but at that time we were totally prepared. Our surveillance scheme, we have some trained team in airport to trace the coming passengers, and everything was ready. Donning and doffing of the PPE, every training, how to clean. Cleaning staff also get that training, even in Nipah period also. That work, that systematic work helped us to tackle the problem in the Nipah case and also COVID case, And now we have several suggestions. We suggested that doctors should give antibiotics only in a separate cover, a blue cover. That also, I think, help the poor people to understand which medicine is antibiotic, which should be looked with care, and that kind of several instructions are there. I am not explaining everything. Yes, I have to conclude my speech. Anyway, we started a very good action plan and action in Kerala. Several people from outside also participate in our workshop for framing this Karsa program. Eminent personalities from outside also came in Kerala and helped us. So we became the first state in India to frame a network and an action plan for infection prevention control and antimicrobial resistance. We achieved a lot. I am not explaining everything. During the 2020, I was there up to 2021 as minister. I can say that 2020 December, when we examined, the COVID death rate was such below that it is below 5,000. All the other places have about 25,000 or 1 lakh death. At that time, death toll in Kerala was very low. And after that, we have an election, assembly election, and everyone mingled together, and there is some increase in cases and death. Yet, the percentage of death is very low in Kerala. So, we can work together. I also got some information from here. I heard my colleague's speech before, and I will ask the government to implement all these things there, and we can work together. We are fighting against a great threat, and we are together. When we can tackle the problem, we will overcome, definitely.
Let us put once again one more round of applause for the architect of the State Action Plan on AMR.